Pulse ox 99, BP 108/72.
EFAS negative. Sounds a lot better than the guy next door.
How's the airway?
Good volume, good sats, gag reflex. Present. Intubate. Maybe, maybe not.
Mr. Yee. Joy, sternal rub on his chest like this really hard, please. Mr. Yee.
Don't do that. Oh, you gotta be kidding me. This is crazy. Don't do this. Any medical student watching this, don't do this. Any resident watching this, don't do this. Like, what the heck? This is a trauma. You won't necessarily see a bruise to the chest right away. If his chest took a hit, you can have a sternal fracture. You can have a retrosternal hematoma from that fracture. And now you're just sternal rubbing it. Come on, Pitt. You consulted the wrong ER doctor for this with zero trauma center training. I'm calling this out now. These patients you would be better doing nail bed compression on. Obviously, any noxious stimuli can hurt, but unless you have the trauma imaging, you are not, and I repeat, you are not going to sternal rub the chest. I cringe just thinking about this. The amount of sternal fractures we see in the ER for motor vehicle crashes like this is alarming. Nothing like doing a sternal rub on a fracture. Patient has a non-displaced sternal body fracture, and you just rub the hell out of it. Guess what? Now it's displaced. This is crazy. Stop doing this. This is a trauma patient. Guess what? It's actually contraindicated in this setting to do a sternal rub in a trauma post-MVC. Like, how did the Pitt miss this? I would even argue this is common sense in trauma. This is common sense at a trauma center, in a motor vehicle crash. I don't understand how the Pitt missed this. I'm actually really disappointed.
Spontaneous eye movement, response to pain, GCS is 10, borderline for intubation.
No muscle tone, flaccid paralysis in the left arm.
Same on the right.
And both legs. Add towels to both sides of the collar for more stability. Let's not make this worse.
Hand scan with 3D reconstruction of the spine.
He's quadriplegic? If so, it's a low cervical injury.
Why is that, Joy? C3, 4, and 5 helps you breathe to stay alive.
Pausing now for 2 reasons. 1, we're 7 for 7 on stethoscopes. I love it. Also, Dr. Robbie states C3, C4, C5 helps you breathe to stay alive. Now, I always say C3, C4, C5 keeps the diaphragm alive. That's the common one that I hear, meaning in this case, the patient's diaphragm is not paralyzed. They're still spontaneously breathing. So any injury to the patient, any injury that he had would be below that particular spinal level, would be below that region. So this is referencing that phrenic nerve that is formed from the nerve fibers of C3, C4, C5, and it provides that motor and sensory to the diaphragm. If your diaphragm was paralyzed, respiratory function would be compromised. Various cardiac arrhythmias could occur, just to name a couple issues.